Hi, my name is Jennifer Jones. I'm here today to talk about what it's like to be a school nurse. The group that I am presenting with is going to be Stacy Williams, Amanda Pendleton, and then myself, Jennifer Jones. So the first thing I'm going to talk about are the roles and the scope of practice of what it is to be a school nurse. The school nurse is going to utilize the most current evidence-based practice to integrate and instill programs in the school that are going to benefit the children. They're going to enable students to make life decisions by encouraging self-empowerment. They're also going to teach them problem-solving skills and communication skills. They are at the forefront of implementing programs by working with both the family, the educators, and the children themselves to inform programs that benefit the children and all those involved. The next role that they have is going to be community and public health advocate. They are going to focus on disease prevention and health promotion within the schools. Again, they are going to form programs that focus on these things. Some of the topics are going to include healthy lifestyles, risk-reducing behaviors, preventative self-care, and developmental disabilities. The next role as a school nurse is going to be care coordination. This is a very unique role to the school nurse because they have the unique position to be, they're going to be hands-on with educators, children, and families, as well as sometimes case managers or primary care providers. They are going to develop individual education plans or IEPs for children catered towards their individual needs. They're also going to, another role is going to be, they're going to be provided skilled nursing care. This is going to include administration of like flu vaccine. They're going to assist children in any emergency situations, possibly the use of an EpiPen. They're also going to assess children that are sick in the school and assess whether or not they need to go home and treat them accordingly. Another role is going to be maintenance of records. They're going to perform healthcare screenings. They're going to check for things such as lice and such. They're also going to maintain records following HIPAA laws, providing privacy and safety for their patients. They're going to also keep up on vaccine records. They're going to make sure all the kids are current on their vaccines, and if not, then they're going to contact the families and make sure that everybody is up to date on everything. Quality improvement, this is much like all RNs in the field. We are going to constantly reevaluate what we're doing and make sure to implement new skills and implement new changes based on the most current evidence-based practice. Next, I'm going to go over teaching strategies of the school nurse. There are going to be 3 different levels of prevention, and you're going to base your teaching based on these levels of prevention. First, there's going to be primary prevention. This is going to actually focus on actual prevention of things such as substance abuse, disease, childhood injuries, and vaccines, such as the flu vaccine. Secondary prevention is going to be all like screening. It's going to be setting up emergency and disaster plans, and then identification of abuse and neglect within the household. Tertiary prevention plans are going to be long-term plans. These are going to be for children that may be obese, children with diabetes, or pregnancy. And then some actual teaching strategies themselves. It is the responsibility of the school nurse to utilize all resources. This includes family, educators, and caseworkers in order to form a teaching plan that's going to benefit everybody. You're going to evaluate the learner's ability to learn prior to establishing a teaching plan. So assess and evaluate the children, and then cater their sessions based on what they have the ability to learn. And then make it fun. When you're dealing with kids, you want to use things like play games, be creative, try to think outside the box, and make it hands-on. Kids are going to learn better, teenagers are going to learn better if they're involved with their plan of care and they're learning things and having fun at the same time. So next, Amanda is going to present her part.
Hi, I'm Amanda Pendleton, and I'm going to present the educational prep that a school nurse would have to go through, and also any interactions they have with other professionals or other people in the community. So first, we're going to talk about the educational preparation or training required to function as a school nurse. The state of Florida requires you to be a registered nurse. They also use lower level nursings like LPNs and assistants, but to have the title of a school nurse, you do have to be an RN. The state of Florida does not require the National School Nurse Certification. This is nationally governed at a state level, so this is subject to the state's requirements. So some states do require certification, but our state, the state of Florida, does not. The School Health Services Program Office recommends school nurse certification, and information on certification can be found at www.nbcsn.org. So yes, there we go. Nope, I think one more back. There we go. Sorry about that. So what other disciplines and professionals does the nurse interact with the role? Oops, sorry, that goes to the previous one, but back to the certification. National Board Certification of School Nurses, which is the acronym NBCSN. You'll see that a lot on the website, obviously. They endorse voluntary certification by examination for all school nurses. As I mentioned, it's not required in Florida, but a lot of states do require it, but most do not. Certification represents national standard of preparation, knowledge, and practice. And as of January 1st, 2020, they will require you to have a BSN to sit for the exam. As of right now, you can do it with just an ADN or lower, but right now you have to be a registered nurse to sit for the exam, but as of January 1st, 2020, you will have to have that BSN. Okay, so other disciplines or professionals that the school nurse interacts with in that role, I mean, it really is a wide range of group of people. So obviously, she interacts with the teachers. The school nurse does a lot of education with the school staff and the teachers, security, principal, the cafeteria staff, the whole staff at the school, to educate them with, most of it is with students that have chronic illnesses and their symptoms that they can intervene and be assessing for throughout the day. They also work directly with the teachers and the students themselves, so they can look for symptom management and interventions in the classroom to maximize their time in the classroom, to keep them away from the school nurse's office. She interacts with social workers, school personnel, school counselors, psychologists, community health providers. A licensed practice nurse works under him or her, and unlicensed assistant personnel, like medical assistants. I actually reached out to my son's school nurse at his elementary school, and they said she was not there at the time, that she actually serviced a lot of elementary schools. So the school nurse is not necessarily at that school at that time. He or she may have to work at a lot of other elementary schools, so she does have to delegate work to LPNs and medical assistants, and really educate the school staff on students that she's aware of, either emergency crisis that could evolve, or chronic conditions like diabetes or respiratory issues that students have, so they're aware of interventions that they can provide. Thank you, and Stacy will be next.
Hi, I'm Stacy Williams, and I'm going to talk to you today about the necessary skills and abilities required for this role. There are many skills and requirements to be a school nurse, believe it or not. We need to be able to not only treat the patients, but we need to be able to treat staff members as well. So we need to be able to perform physical assessments, administer medications as needed, not only to possible staff members, but also to patients, the students as well. We need to be able to control and monitor the students affected by chronic and severe illnesses by building a network with families, teachers, different health professional workers at the school and within the school's community. We need to be ready to provide any sort of emergency care, not only at the school, but at any school functions as well. We also need to be able to check blood glucose levels, whether the patient is a known diabetic or whether they are showing signs of symptoms of hypoglycemia. Communicating with all staff members and parents about medical issues if the child is injured at the school, if there's concerns about any sort of cuts, bruises, whether they suspect lice, several different illnesses or issues that we may need to communicate with these parents. The nurses need to be able to educate them and notify the parents. Next up, providing care for staff members as well as the students. Like I said, we need to be able to educate everybody, educating the students, staff members, Oftentimes, student nurses will, the nurse will go in and educate the students at the school, talking to them about washing their hands, preventing flus, preventing colds, also talking to them about dietary needs and what's important, what's healthy, making sure that they are educated on their health, preventing illness, which then again helps them to maintain school, good attendance. Next, again, Jennifer touched upon this, but we're going to go over this again because it is a skill and ability that they need to be able to deal with. Managing and organizing the charts, making sure immunizations are up to date, making sure that they're allowed back to school if they've been out for an illness, making sure that absences and stuff like that are excusable from a nurse's perspective. Okay, still, necessary skills and abilities. There are a lot of skills and abilities required to be a school nurse. The school nurse is not only required to respond within the school, but she also needs to be able to collaborate with the school community, the school board, sharing her expertise. They do have meetings, they have to show up, implementing different rules and regulations. Again, the quality control, making sure things are up to date. The next thing is advising parents and health professionals when specialized care is needed. If the school nurse is noticing that new healthcare trends are changing with a particular student, the school nurse is going to have to again communicate not only with the school board but along with the parents to address the issue for the particular student. Some children have chronic illnesses yet are able to go to a public school or a private school. So in that instance, there could be a child that has a trach and we need to be able to provide suctioning or any sort of tracheostomy care if they need it. Up next is unique and interesting things about being a school nurse. There's several different things that are pretty interesting about being a school nurse. I never stopped to think about how many people they're actually responsible for. So the amount of responsibility, not only caring for the students, caring for the staff, being there at school functions just to make sure that if they needed a nurse there, she's available. The education involved for not only the staff members, but the students. When you stop and think about the school nurse, you think she's sitting in her clinic just waiting to see people who have cuts and bruises. No, she's going to the classroom, she's going into the cafeteria, she's making sure that they're washing their hands. Do they know what the flu is? Do you know how you get it? Do you how you spread it? What a healthy diet is. They're talking about many different things. They're responsible for hundreds of people. Again, I only thought about the school nurse as caring for students. They care for the students and the staff members alike. They also have several amounts of skills. Again, we talked about blood glucose levels, checking for lice, doing physical assessments. If somebody gets injured on school property, she's the first responder to assess them. Other interesting facts about being a school nurse is that the nurse has been part of the school setting since the late 1800s. So I had no idea how long school nurses have actually been in this role, but since the late 1800s. Another thing that I think is interesting but kind of depressing is the low salary for a school nurse. They only make $20,000 to $40,000, yet have so much responsibility. I hope that you have enjoyed our presentation on the community school nurse. If you have any questions, feel free to go to these websites and or reach out to us. Thank you so much.